Okay, let's unpack this. We're diving into something that, well, it causes a lot of discomfort, a lot of anxiety for so many people. That whole cycle of stomach pain, acidity, acid reflux. So today, this deep dive is all about gastritis. What exactly is it? Why can the symptoms feel, frankly, terrifying? And maybe most importantly, how the real causes often link back to really simple daily habits we don't even think about.
Right. And to start, let's just get a simple definition out there. Gastritis is basically a localized inflammation right there in the stomach lining, the mucosa.
Just the lining itself.
Exactly. And, a lot of people might brush it off as just a bit of an ache, maybe something they ate. But it's important to understand this can actually lead to some pretty serious stuff down the line.
Like what kind of serious?
Well, ulceration, for one,
Hmm.
actual sores in the lining, even loss of blood. And critically, especially if it's linked to that bacteria Helicobacter pylori, there's even an increased risk of gastric cancer.
Wow. Okay, so not just an upset stomach then.
No, not at all. It's a genuine systemic issue. It can really limit you, professionally, nutritionally.
Mm-hmm.
It impacts your whole life.
So let's talk symptoms. If that lining's inflamed, what are you actually feeling? Because the main thing people report is that sharp, acute pain, usually right behind the breastbone, that burn.
That burning sensation. That's typically from excess hydrochloric acid, HCl, moving up towards the esophagus. Reflux.
Okay.
But here's where it gets, well, really interesting and honestly, pretty scary for the person experiencing it.
How so?
That intense pressure, the pain, the reflux.
Yeah.
It feels so severe that it's very often mistaken for a heart attack, a cardiac event.
Yeah, you hear that all the time. People rushing to the ER.
Exactly. They go in, they get the ECG, all the heart checks,
Yeah.
and the cardiologists find nothing wrong with the heart.
But the feeling is real.
Oh, absolutely real. The patient's sensation of pain, that intensity, it's enough to cause massive anxiety. It leads to a lot of medical confusion.
And even when it's not that acute panic level, the day-to-day isn't great either, right?
Not at all. Think slow digestion, feeling constantly bloated, gassy, nausea, sometimes even vomiting. The whole digestive process just kind of grinds to a halt.
And that constant discomfort must really affect certain groups. I'm thinking about athletes, for instance.
Oh, definitely. Athletes are a key example. You have people who need a huge amount of calories to perform and recover.
Yeah.
But if every time they eat, they associate it with pain, nausea, that awful bloated feeling, they can develop something that's almost like a phobia of food.
A food phobia? Because
Yes.
eating hurts.
Precisely. So they start avoiding the calories they desperately need. And that immediately hits their performance, their recovery, their overall nutrition. It becomes this vicious cycle.
Their need for fuel is actually causing their pain.
Exactly.
And if we just focus on treating the burn, the nausea, the short-term stuff, we're missing the bigger picture, the chronic damage.
That's the real danger. That constant cycle of reflux, of inflammation, of ulceration. It can eventually lead to a condition called Barrett's esophagus.
And that's serious.
Very. It's recognized as a precancerous lesion. It's basically the tissue changing because of that chronic, long-term damage. So, yeah, if we want to actually heal this, we need to look beyond the symptoms. We've got to dig into those daily root causes.
Okay, root causes. What are we talking about here? Because it sounds like it's not always about an infection like H. pylori.
That's what's fascinating. While infection is a factor, a lot of the main drivers are actually lifestyle-based, things we do every day, and they mostly boil down to stressing that stomach lining constantly without giving it a chance to rest and repair.
Okay, like what? What's the biggest offender according to the research?
Well, one huge one seems to be continuous eating, the constant snacking all day long, grazing.
Right, the picoteando, as they say. Is it the amount of food or just the fact that the stomach never gets a break?
It's kind of both.
Yeah.
But the consistency is maybe the bigger issue. When you eat constantly, especially as large meals or meals high in protein, you're basically forcing your stomach to keep pumping out large amounts of concentrated hydrochloric acid to break everything down.
Makes sense. More work for the stomach.
Right. And that high-intensity, nonstop acid release, meal after meal, snack after snack, it really irritates and damages the stomach wall over time. Think about bodybuilders, powerlifters, people who have to consume enormous amounts of calories. Their stomach lining is under constant acid assault. It rarely gets any downtime.
And for that lining to even defend itself, it needs certain things. The research really emphasized hydration, which, honestly, I don't usually connect directly to stomach pain.
But hydration is absolutely crucial. Think about the structure.
Okay.
All our digestive linings, esophagus, stomach, intestines, they need to be properly hydrated to maintain their integrity. their protective barrier. If you're not drinking enough water, that lining gets compromised. It gets weaker, thinner.
So it's more vulnerable.
Exactly. Then, even minimal contact with that concentrated stomach acid causes immediate inflammation, maybe even ulceration. The water is literally part of the protective structure.
Okay, that makes sense. Then you add in things like medications and habits.
Yes, the chemical exposures. The sources point to common culprits strongly linked to gastric ulcers. Things like NSAIDs, aspirin is a big one, but also certain antibiotics, corticosteroids.
And the usual suspects.
Right. Caffeine, alcohol, tobacco, they all contribute to general inflammation and can irritate the lining.
And what about stress? We hear about stress ulcers. Is that a real thing?
Absolutely. There's a definite stress connection. When you're under high stress or even doing intense competitive sports, your body releases adrenaline. That doesn't just speed up your heart, it also ramps up HCl production in the stomach. And it can even directly compromise the mucosa, possibly through dehydration effects too.
So the stress itself is causing physical damage.
Yes, that's basically what somatization means in this context. Emotional or situational stress is manifesting as a real physical problem in this case, damage to the stomach lining. The mind-body connection is very direct here.
Okay, so if someone's having really bad symptoms like active bleeding or just unbearable reflux, doctors often prescribe antacids, right? Like omeprazole, ranitidine.
Yes, and let's be clear, in those acute, severe situations, intense suffering, high risk of complications, those medications are essential. They have their place. We're not arguing against using them when genuinely needed.
Right. But the problem comes with long-term, maybe self-prescribed use, like keeping a pack in the cupboard just in case.
That's the issue. What happens when that quick fix becomes the default, the chronic habit? You're suppressing the symptom, the acid which provides relief, sure, but you're completely ignoring why the acid is causing a problem in the first place. You're not addressing the underlying causes we just talked about.
The constant eating, the dehydration, the stress.
Exactly. So you mask the problem, but you prevent the stomach lining from actually healing naturally in the long run. You're just kicking the can down the road.
Okay, so if the root cause is often workload and lack of rest for the stomach, then the real strategy has to be about reducing that workload, giving it a break.
Precisely. The management has to focus on letting the stomach rest and regenerate. So we look at diet, timing, and hydration.
All right, let's break that down. Diet first. What changes help?
Start with portion size. Smaller meals, less overwhelming for the stomach, that's key. Then think about composition. You want to reduce the stomach's workload, so maybe temporarily cut back on animal protein, which demands a lot of acid to digest.
And favor what instead?
Easier to digest options. Things like pseudo-cereals, quinoa, amaranth, millet, buckwheat are great, or legumes. Plant-based proteins are generally less demanding.
And the sources mentioned dairy.
Yeah, some people, especially when things are really flared up, find that temporarily removing dairy helps calm things down. It's worth trying if you're in an acute phase.
Okay, and what about vegetables? Usually we think more veggies the better.
Generally true, but in this specific case, you might want to temporarily reduce the ones that cause a lot of gas. So the cruciferous family, broccoli, cauliflower, cabbage, Brussels sprouts, and maybe garlic and onion too. If you're already feeling bloated and inflamed, adding more gas pressure just makes it worse.
Right, makes sense. Less pressure. And what about timing? You mentioned rest.
This leads us straight to the idea of intermittent fasting, or IIF. If you can create a window, say 16 hours, where you're not taking in solid food, you give that gastric mucosa significant time to just rest, regenerate, heal.
16 hours of digestive downtime.
Exactly. But that rest period is only truly effective if the body has the resources it needs to repair. And that brings us back to
Hydration.
hydration. You really can't overstate it. Aim for at least 1.5 to 2 liters of water daily, maybe more if you're active. But it's not just the amount of water, it's also about making sure your body can use it effectively.
What do you mean?
Well, the research suggests adding minerals helps, electrolytes, or even just a tiny pinch of good quality sea salt in your water. This helps your body actually absorb and utilize the water to sort of rebuild and fortify that mucosal lining against the acid.
Interesting. Okay, something else that came up which I found surprising was food temperature.
Ah, yes. Often overlooked, but quite important. That stomach lining is sensitive tissue. It really doesn't like extremes, especially very hot temperatures.
Like scalding hot coffee or soup.
Exactly. If you regularly consume food or drinks that feel like lava going down, you could be causing direct thermal damage, localized inflammation. It can even trigger what's called a localized immunological alteration, basically. Your immune cells rush to the area because they detect damage from the heat.
Wow. Okay, so let the soup cool down a bit. Good tip. What about natural aids? Things to help digestion along.
Yeah, there are things that can help pre-digest food a bit, lessening the stomach's burden. Digestive enzymes like bromelain, which you get from pineapple, and papain from papaya, are known to help break down macronutrients.
Okay.
Supplements like psyllium can help with overall digestive function, and aloe vera is known for its soothing properties and helping with gastric hydration.
And spices. I know some traditions use spices for digestion.
Definitely. Ginger, black pepper, turmeric,
Yeah.
these have a long history of use. They're recognized for supporting good gastric function. They're even used traditionally for pregnant women dealing with gastritis.
But there's a warning with one specific herb, right?
Yes, a crucial one, licorice root. It can be fantastic for healing ulcers and easing reflux. Really effective for some people. However, if you have high blood pressure, hypertension, you absolutely must avoid it. Licorice is known to raise blood pressure. Very important distinction.
Good to know. Okay, let's circle back to the bacterial factor we mentioned earlier, H. pylori.
Right. Helicobacter pylori is a common bacterium, a frequent cause of ulcers and chronic gastritis. It triggers excess acid release, causes pain, interferes with nutrient absorption. The standard medical treatment is usually strong antacids, plus a course of 2 different antibiotics.
A kind of carpet bomb approach to get rid of it.
Pretty much. And sometimes that aggressive approach is necessary if the infection is severe and causing major problems. But it does raise the question, are there gentler ways to manage the situation, maybe support the stomach's environment, without the side effects of broad-spectrum antibiotics?
And the research pointed to something specific.
Yes, a particular probiotic strain, Lactobacillus reuteri.
Okay, Lactobacillus reuteri. How does that work differently from the antibiotics? Is it like peacekeeping instead of warfare?
That's actually a really good analogy. L. reuteri doesn't seem to work by killing H. pylori directly. That's the key difference. Instead, it seems to help balance the whole gastric environment, the territory, making it less hospitable for H. pylori to proliferate wildly and cause symptoms.
So it controls the population rather than eradicating it.
Exactly. It helps regulate the internal ecosystem so the body can manage the H. pylori levels naturally. And interestingly, some analyses showed patients testing negative for H. pylori after using L. reuteri for a while, suggesting it helped bring the levels down to a non-problematic baseline.
So what's the recommendation there?
The suggestion is it might be worth trying L. reuteri for about a month, especially in less severe cases, to see if it helps restore balance.
And if the antibiotics are necessary because the infection is just too advanced, what's the final piece of advice?
If you do need that standard antibiotic treatment, it's absolutely crucial to protect the rest of your gut microbiome. Those antibiotics are powerful and non-selective. So you must use supportive measures alongside them, things like other probiotics, prebiotics, fermented foods like kefir or sauerkraut. You need to mitigate the collateral damage to your beneficial gut flora.
Okay, so wrapping this all up. This deep dive really shows that while gastritis feels awful, debilitating even, its roots are often in these really basic day-to-day habits. The constant eating, not drinking enough water, stress, maybe some medications or habits like smoking or drinking.
Yeah, the lifestyle factors are huge.
And while those antacid meds are definitely needed for crisis moments, the real path to long-term healing seems to be about respecting the stomach's basic needs.
Needs for rest, for less demanding food, for proper hydration.
Right, giving it a chance to actually repair itself.
So, what does this all really mean for you listening? We tend to reach for quick fixes for symptoms of distress, right? Whether it's physical stuff like acidity or even those stress ulcers we talked about, this somatized emotional pain. We want to shut down the symptom fast. Slap on a Band-Aid.
Turn off the alarm bell.
Exactly. But maybe the deeper insight here is that the lasting solution isn't just about turning down the acid valve. It's more fundamental. It's about respecting our body's actual physiological needs, particularly the need for digestive rest and adequate hydration.
Things we often sacrifice for convenience or habit.
Yeah, totally.
Yeah.
So maybe just consider how much of your own daily discomfort, maybe that bloating or indigestion you just live with, could actually be rooted in simple things like eating constantly or just not drinking enough water. What's one small habit maybe that you could change starting today that would just give your hardworking stomach lining a bit of a break, something to think about?